Good afternoon and welcome to Leveraging Integration and Automation to Drive Towards Systemness, a Health System CIO Media Inc. production sponsored by Laserfiche. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the monitor of Health System CIO, and I'm the founder and editor-in-chief of Health System CIO, and I'll be your moderator today. We're looking forward to your participation. You can send in your questions or comments anytime in the Q&A box, and we'll take those later in the program. Just so you see how we're going to spend our time today, first we're going to go about 35 to 40 minutes with our main panel discussion featuring Dr. Shafiq Rob, EVP, Chief Digital Officer and Systems CIO with Tufts Medicine, John Henderson, VP and CIO with CHOC Children's, and Grace Nam, Strategic Solutions Manager for Healthcare with Laserfiche. And then we will have our Q&A. So let's jump right in. Dr. Rob, you want to start off, give us an overview of your organization and your role.
I'm lucky enough to work for Tufts Medicine in the Commonwealth of Massachusetts. We are an academic medical center with a couple of community hospitals. We also have a home health, and we also serve our community, both our employed physicians and independent physicians. Over 2,000 independent physicians are part of our clinically integrated network. We do the most transplant in the Commonwealth of Massachusetts. Our number one goal is to provide healthcare in an affordable way, to be the lowest cost provider of healthcare so that people can live better, have better quality of life. And we're also known for our NPSR and all kinds of scores. We are way above than normal. Most people could be at 50, 55. Our scores are above 86. So we take a lot of pride in our work, and our doctors are phenomenal. Our researchers are phenomenal. We have a medical school. So I'm lucky that I work for this organization.
That's great. Thank you very much. John?
Good morning, Anthony. Good to see you. John Henderson, as you mentioned, I work for Children's Hospital Orange County. We are a pediatric health system in Southern California. We also have 30 plus primary care practices around Orange County, as well as 35 plus subspecialties. As I've said, pediatric health system, we're focusing on really trying to create a healthy community all across Orange County. With the types of services that we're providing. We service a wide range of communities, even beyond Orange County. We move into the Inland Empire, which is a little further east of California. And we're continuing to grow, have great partnerships with UCI Health. We've recently opened a joint facility called the Center for Advanced Care, where we have a combination specialty primary care locations, so we can really serve the full patient experience, where we provide not only primary care, but if we need them to see a specialist, we can put them in contact and basically move them down the hall to see that specialist. It's a great partnership with UCI Health, leveraging some of their diagnostic services that they'll provide to us. And so excited to be here to talk to you about what we're doing today.
Thank you, John. Grace?
Yes, thanks, Anthony. And it's my pleasure to be here with Dr. Rab and John Henderson today. So yeah, my name is Grace Nam. I'm the Strategic Solutions Manager for Healthcare at Laserfiche. So what we do in Laserfiche is that we are global enterprise content management system. So our core key process is process automation that's powered by AI and machine learning. And with the intelligent data capture process, we are supporting organization, especially in highly regulated industry, really to streamline this process at the end to better support patients and staff in healthcare space. So we have been growing rapidly, and I would love to share some of my kind of secondhand view experience on how some of the organizations in healthcare are making this success today with some of the implementation strategies. So excited to be here. Thanks.
All right. Thank you, Grace. Excellent. All right. There's way too much on this slide, but we'll jump in and take it in bites. So Where are you in your drive towards systemness? Can you offer some examples of what it means to operate as one health system rather than many semi-independent hospitals? Why is this important to achieve? What are the biggest challenges? And what's the impact on patient satisfaction, clinician satisfaction, and patient care when parts of a health system have unique data silos and processes? Do current demographic trends around a shrinking clinician workforce make this troubling? And I think that goes to job satisfaction. If there's any issues around technology that are frustrating users, you don't want to be losing people these days because there's certain workforce issues. So back to the general drive towards systemness and your thoughts on that. John, we'll start with you.
Sure. I like to use numerical ratings. So, if I'm doing a 1 to 5 scale, with 5 being, hey, we're there, everything we do is fully with a systemness view, I'd say we're a 3 and continuing to gain momentum. For us, it's been a journey as we've grown. So, I think one of the things that's unique for us in a way is we have two hospitals. One is a hospital within a hospital. It's our smaller location, and so we leverage the EMR from Providence, St. Joe's. Our main hospital, freestanding, our own EMR, and we manage everything there. And so one of the things that's important for us is to make sure we have the same level of clinical decision making and order sets and all of those things across 2 different EMR systems. And so our approach to that is to work with Providence to make sure what we need in that EMR is matching what we're doing at what we call our main campus. And it takes a group. It takes our physician community, our physician champions, our administrators, our nursing teams to really make sure we're keeping those things in sync, because we don't want to be in a position where we have different levels of care between those facilities because we have 2 different EMRs and they're managed differently.
Hey, John, do you have doctors that practice at both those locations? And what you're trying to do is make sure they have the same experience?
Yes, it's exactly that. And it's a little difficult because not only is the administration and oversight of the EMRs different individuals, different organizations, but the actual EMR is different. So one is an Epic EMR at the hospital with Providence, and we're a Cerner Oracle organization. So the look and feel, they're pretty similar, but it's really also making sure we have the same order set, same documentation, protocols, and all of those things across both of those locations.
Yeah, so that's the idea of sameness and systemness, really
Yes.
as pertains to the clinician experience. And obviously, there's all kinds of stuff we'll talk about that relate to the patient experience. So, very interesting point. Dr. Rob, your thoughts here on the slide.
I was lucky enough to be recruited at this prestigious institution 4 years ago. And at that time, it was known as Wellforce. We were a holding company, and now we are an operating company. So I don't know who made you ask this question, but maybe you knew that. We had 28 electronic health records, 28. We had 111 patient portals. Think about that. Today, we have 9 HR systems. Today, we are 1 EMR, 1 patient portal, which is an app, front door, and 1 HR system. Drove us nuts to do this because change management, stress on the institution, and we did the EHR during the COVID, workforce shortage, put a lot of stress on us in doing that. And training, retraining. But after 4 years, it's been 2 years, we have been live on our Epic journey. I became the first person to put Epic in the cloud as well. So we had to do innovation at the same time. We built a lakehouse, which is artificial general intelligence ready, because we had to build a FHIR schema. But that's not what it is. I think the biggest gift that came was from physicians working all the places. The biggest gift came from operational leaders getting together. The biggest gift came when some people had never seen each other. And we are still struggling. We're still straightening it out. But it's still going to become one. We still have 3 packs. We have to become 1 packs. So we still have some systems that are still more than one. But the operational leaders and the doctors and the physicians and the nurses, we're still working in making them as one committee, and they are supporting and helping. So when you're asking that, we're still understanding how to do it one way. We're still trying to work towards that. And somebody said it takes about 5 years for the culture to become one. We can't wait for 5 years. Then we built the clinically integrated network. What that does, we started giving Epic to our community doctors. So that means we have 400 physicians who are totally independent, 40 practices. You know what I'm saying? So we brought all of this upon us so we can become one system, one way to think for the greater good of the community that we serve. So we become a healthy related place, wellness related place as compared to sickness.
Mm-hmm. Would you say that you have to start with the technology and start with the applications? You mentioned going from hundreds down to 1, this kind of a thing. That's not the final. That doesn't get you the final state of culture. You talk about 5 years for culture, but would you say that the foundation is the technology, and that has to be streamlined and standardized first, and then the culture can flourish on top of that? Because you'll never get it the other way around, right? If you don't standardize the technology, and there are 15 ways of doing things all over the health system, you'll never get the culture done. Does that make sense?
Yeah, but I will disagree with that. I think the workflow and the processes and the operation need to govern the technology. So we did use the technology and the changes as a catalyst, but I still believe, and I still will say, that the operations and the systemness is more important than the technology. Technology is the easy part.
So you have to, okay, so good point. So you have to, that's something that's got to be thought about at a high system level. Let's get everybody to do things in the same way. Can they work in tandem at the same time? Or we're doing these things like IT's doing its part to streamline things? No, workflow first.
People together first, leader together first, workflow first, and basically they are the one who make the decision. They are the one who decided, and they have the right to change their mind also, right in the middle. My colleagues can, John, I mean, you have done it many times, brother. Help me out.
Yes, I completely agree. And so I'll give an example. When I first got to Children's, our primary care network was not on our main EMR. They were not on Cerner. I think there was 5 different EMRs. And we got together and said, hey, we really want to be a real integrated system. And here's the benefits of that. And I wasn't leading the discussion. I was a part of the discussion with operations, with our strategy officer. The decision was, hey, if we're going to deliver the experience, if we're going to provide consistent care across the continuum, this makes sense for us to do. Now, everyone said yes, but then we had to do the real hard work of workflow standardization. How's this going to work? How's it going to work for you? Because everyone's workflows and systems were designed for those practices specifically. And everyone wasn't going to necessarily get exactly what they had before. So they have to accept and make those decisions so then we can enable and implement that standard across. And those things went together, but they had to agree to come along for that ride before we could even get the technology piece moving forward. And it's not always easy. It's not, it's not always easy, and there's bumps along the way. we had to come back after getting everyone moved on to one EMR instance. We had to go back and do, I call it, we had a SWAT team to really come back and do deep dives with operations, going to those locations to really see how they were experiencing it, so we could determine what can we do to optimize and enhance it to make it better. Because they didn't know what they didn't know, because they had never been on this new system. And we implemented, and we had to make adjustments. And we eventually got to where we needed to get that consistency and adoption.
John, if you could just give me a little more information and about, you use the term we're together, like IT and the business doing this sort of together, but
Mhm.
we want the workflow. First, we need buy-in, right? At a high level.
Right.
Someone's got to say, we want to do this. This is what we want to do. But I'm just trying to understand more IT's role in that process and the timing of getting workflow standardized, which would be a business or operations function, and IT coming along and then trying to standardize applications by reducing the number of apps and standardizing on a few. Tell me about sort of trying to stay in lockstep with the business, not get too far ahead, but not be too far behind.
Right. So with the example of getting to one EMR, that one was, you got to get agreement first. So it was an operations-led decision, business strategy to do this. Technology was secondary. Now you get into the implementation, that's where IT is helping with facilitating the workflow discussions to help get to standardization. So you have that aspect of it. But sometimes we do bring the conversation to the business, and that's part of developing and cultivating the relationships with your peers, so that in our role, it's not always about them having to come to us asking us to help them. Part of our role is being able to understand what's happening within their business areas and going to them and saying, hey, I believe we can help you. Here's how I think you're leveraging 3 or 4 different applications to provide this service. We think there's a better way. Maybe we can reduce the applications that you're using, make it more efficient for you, and give you back capacity. So our role is also to help them see where they may not necessarily see, how shrinking their portfolio of applications can help them. For example, we have our main hospital was on a staff scheduling system, not necessarily delivering everything they wanted. Our smaller location was on a different system. We came to them and said, hey, if we're going to really support staff scheduling for our nursing community, we're going to need to do something different. And so we got both groups together, evaluated solutions, and they both decided, hey, this is the right path for us to get on the same solution, so we can really manage our staffing for nursing as effective as we can. And it's not a scenario that we send nurses back and forth between these locations a ton, but that possibility does occur. And you want to be able to see where that capacity is, and you also want to be able to offer opportunities and shifts across locations. And you're not really able to do that in 2 different applications. I mean, we could make something custom. We can build something really unique and custom. A lot of effort and investment to do, but why do that when there's getting onto one system that already does it is a much more effective way, and probably a lower cost way when you think about total cost of ownership.
Anthony, to answer this question in a different way, I'll take only a minute, not more than that, is that we have to understand what is the value. So the value is that we need information, we need data, and we need to serve our communities to stay healthy. That's our value. And to do that, there's a workforce that does work. And then we say, let's use technology to work together on one system. That means there is a change in the workflow. So we got to train them, right? Then we say we want to collect all that information and present it to you. So while we are doing this, if the business leader does not lead it, technology can build something else, not going to work. Second part is that it takes a year, 6 months to get used to the technology that you are doing there. Third part that comes in, that you have to have a short-term plan, you have to have a mid-term plan, and a long-term plan, and you have to have a North Star. The last point is that with the new advent of ML, AI, and all those things, people want to use that also at the same time when you have done something. But in the middle, we have to document the workflow, we have to document the processes, and then the aha moment comes, hey, our workflow is not that smart. We could have cut a couple of things in. And from there, we start saying, okay, we can automate, because the salvation lies in automation. I'll give an example. Claim goes out, right? But if you put a bot on it, it checks if the eligibility is right. It checks if the coverage is right. Then let the claims go. The claim is clean, you don't get denial. But before that, we have to build the claims to go out. Before that, the senior revenue cycle officer will tell us, this is how the claims goes out. You know what I'm saying? So when that comes in, companies come in and say, we can improve your workflow, we can improve your processes. Few people document that. And once you document, it's a hard work. There is no easy way out of it. There's no ML AI tool that will clean it up. But once you have done that clean data, you get to the nirvana of machine learning and AI that makes us go faster. But the key element in this is the business leader and the physician and the nurse and the clinical partner. Because at the end, we are serving them to make the lives of the patients better, to make the customers better. And the part that IT leads is the communication, the connectivity, the Wi-Fi, the ML, AI, and all those things to make it better. At the end, it's a one app.
Well, I've never seen heads bobbing like I did from your co-panelists as you were answering that question. I want to bring Grace in, then we'll go to John. Grace, Dr. Rob had an amazing line there in addition to his other wisdom he was dropping. Salvation lies in automation. Wow, that's big. Grace, your thoughts on what you're hearing, wherever you want to jump in.
Yeah, no, I couldn't agree anything more. I mean, healthcare is one of the highly regulated industries, right? So that means there are often a lot of documents, patient information. And as much as we want to just focus on patient experience as, you know, from the moment they just walk in to a physician office, it's actually not that simple from front to me to back and office process, right? I mean, as much as we are hyping about around AI, I do think it is real. However, as Dr. Rapp pointed out, AI and machine learning, which also end up being process automation to really streamline this process to reduce staff burden. It really can't work efficient way in the true sense of healthcare data and records, medical records, information management, if there's no centralized structure, standardized process that is really eliminating all these data silos, right? Some of the things that I often hear about from our end user customer is often, I think, often like in the organization, the leadership normally have initiatives that pictures, right? And there are end users, teams, departments, and different offices where they all see their, day-to-day experience a little bit differently. I think it's much more successful as both panels just engage. I think end user activity is just so much more important, engaging them in the very front point of the purchasing or any implementation process does matter. They do have to be excited. Some of the successful rate that I have seen is instead of just focusing on those top initiatives overall, the organization, in order to get there, let's break down what are some low-hanging fruits are, right? So it can be where the areas, for example, front office, when patient walks in, staff may have not necessarily went to, gone education and training process to enter like a patient information data, right? And also it's not fair as we talk about systemness. Patient walks in every time they visit maybe different physicians or different offices. They may have to sometimes fill out, even myself, on the paper clipboard, the long pages of information that I repetitively have to put in. So, I mean, as we are being people, of course, data silos or error can happen that can lead to the entire patient journey. So just let's focus on where step takes most time, where we are spending more time really fixing those errors and mistakes within the process. And once we automate that and get the end user excited, they do talk about with their peers within their organization. And I think it's a matter of time from there. Okay, what is next? So we're more focusing on low-hanging fruits. That's more results driven, and it's more impactful for end users that can spread eventually organization wide.
Very good, Grace. Thank you. John, following up on your head nodding with what Dr. Rob was saying, anything you want to jump in there?
Yeah, I think Dr. Rob hit the nail on the head. When we go about automation, we basically do discovery sessions with the business and operations, and they kind of tell us, here's where we have opportunity, where we think these processes are highly intensive with our analysts and human intervention. And we go in and we do our discovery, and typically what happens is we identify just what Dr. Rob mentioned, that the process is not documented, but their expectation is we're just going to come in and automate it really quickly. And so when we walk them through, here's what has to happen, here's what we need from you. We have to understand exactly what you're doing, because if we're going to develop a bot or a robotic process automation, it's going to mirror everything you're doing manually today. And so we need that documented. You can't just tell us what it is. We need to go through that process. So that's the key thing. And once you work with a group, you get through that one time, then they get it. But it's the technology is the technology, and that's always the easy part. It's the process, it's the workflow, it's the change management aspect that goes with it. One example I'll give you that with our call center. So we're not centralized across our organization. We have a main patient access call center, but we have several others. So Revenue Cycle has a customer contact center. We have a group that takes nurse call, after hours advice. And so as we go on about looking at how do we advance our experience with our patients and really create a scenario where we are feeding these call centers all the same information, so that when our patients interact with them, they don't have completely different experiences and are different information. How can we impact that? So we landed on, hey, we're going to go with a new cloud-based call center. We're going to standardize, we're going to integrate patient information into this technology. And as we implement, we won't do big bang. We implement with our patient access center, get that right. Then we go to the other groups, and they get the benefit of everything that the patient access center has already gone through. So their deployment, their adoption and experience is even better. And we've kind of taken the approach that we're not going to do these big bangs deployments. We're going to do it small, get a good experience, and then build on it and deploy. As we optimize, we're taking the same approach because we want to make sure the adoption happens. We also want to make sure we're delivering a consistent experience across these different groups for our patients and patient families to make them more efficient, but also to make sure the patient experience is consistent across all three.
Excellent. Go ahead.
But no, I was going to tell you that the reason for all this discussion that you are asking us the question is not only to improve the physician satisfaction, working satisfaction, better care of the patient, but IT has a tremendous pressure on us to take cost out. And to take cost out, we have to standardize. to take cost out, we have to make a short-term plan, mid-term plan, and a long-term plan. And to do that, to take the cost out, we have to take the variability out. And then we have to not only take variability out, but we have to bring in new technology to use machine learning and AI. You see what I'm saying? So to make the data right, you can't have machine learning and AI if you don't have clean data. So therefore, when you're asking these questions, on the back end, my brother and my friends and my panelists who told us and were telling us this story over and over again, we go and we ask, we understand, we work. So working together cohesively towards the North Star on a step-by-step fashion is what is going to make us successful. And only then we can take 20% of the cost out of IT. Otherwise, we will not be able to take the cost out.
Excellent. I want to go back to this idea, and Dr. Rob, let's start with you. This is something that John was talking about. What can be a pushback from users on documenting their workflow. So they want something automated, right? They say, here's some low-hanging fruit, or here's something that's manual in our processes. IT, thanks for coming to chat with us. Here's something we think you could help with. And you say, well, okay, where's the exact documentation of what you do? And they say, well, we don't have it. I kind of do this, and my coworker over there kind of does it a little differently, and this one does it a little differently. And you're saying, well, I can't automate that. That's kind of, because it just doesn't work that way. Now, I want to talk about, do you often get pushback on this request for documentation or huge delays, meaning, oh yeah, all right, we'll take care of that. You never hear back from them because they're super busy. Is this often something that stymies or slows down automation because you're not getting that documentation, they don't have it, and there's not a smooth system? They probably want you to come in and do it. You come in and watch us and you figure out the documentation. But anyway, is this an important point to go through, Dr. Rob?
So here's what it is. We are a service department. Therefore, customer is always right. That's the first sentence. Second, we also know how to manage that. So I'll tell you a couple of examples and my colleagues can agree or disagree or add to it. One, if it's a brand new implementation, there is always somebody who documents things. Because without documentation, without Visio diagrams, we're not doing it. It doesn't happen. But if a system has been always there and you want to improve it, or it's been 2 years, sometimes we bring immersion teams. We get the vendor in, we get ourselves in, we corral, put our users in the palm of our hands and try to get to it. The third way is that there is an immediate need from our customers that will benefit them. So over the years, we have made friends and we cash in our political capital. That means there are people who like us, there are people we work with, and they help us. So whether you call them super user, whether you call them friends of IT, so it's also a relationship thing, which is number third. Fourth, the more constructive way of doing it, you have to have a governance committee. Under that governance committee, you have subcommittees, and there are people who are actually methodically do that. So there's nothing like a pushback. There is a education how to do these things. We at our institution are still struggling with it. Some are in some other places, people have refined it. Some know it in a very structured way. The way John Henderson is speaking, he has made it superior. The way he's talking about it looks like he has figured it out. Or like Grace is telling her she knows the methodology. You know what I'm saying? So it depends. That's why it takes time, but there is no escape from it. It actually happens. And here is the last point. If you do not do it that way, it does not work out. You have to go fix it anyway.
Right.
So therefore, it is better to do it the right way.
There's no way around it. John,
Nope.
You've been characterized as having figured this out.
He's too kind. He's too kind. But when you're in this role and you've been doing it for a while, you understand exactly what he just described. You have business owners that you work well with. They understand you built trust, and they're going to work with you. And when you're talking about this type of thing, they already understand the value because they want the automation, and we're just helping them understand. Okay, we're going to help you get it, but here's what I need so I can get it for you. And so it's that scenario. I don't really run into a scenario now where a customer doesn't want to do the work to help themselves. You don't really run into that any longer because everyone now is really focused on patient experience. There's a cost implication. Trying to lower your costs, that's a real thing. Not just in pediatrics. I mean, the health system across the country, everyone's trying to lower their costs, and automation and doing things more efficiently is the way to do it. And so you don't get the nearly the amount of pushback that I would say I would have received 10 years ago.
Excellent. Grace, let's bring you in here. What are you seeing when you're working with customers? Is this an important part of it, and is this a challenging part of it? And what's your best advice for people that are want to implement automation for their customers, the IT departments in the hospitals? Maybe they're having a little trouble getting the documentation in order to move forward.
Yeah, so I mean, for sure, I think merging part is one of like the biggest part of when it comes to any implementation of the process, right? Just from my perspective, focusing on like our product specifically, we actually do have a lot of end user customers end up engaging and having the ownership of controlling this process, right? So since the process automation basically is pretty much role-based and document-based, as Dr. Rep mentioned earlier, there's a short-term, mid-term, and long-term goals that we can target. So maybe that involves 5 steps in the beginning, but it doesn't really take much of time for staff to realize, oh, this works, and then how can we make it better? Right. So from our own product offering perspective, we do offer products such as Laserfiche forms. Is pretty much drag and drop, like really easy, no coding require process to duplicate documents for a certain process. So from there, it can be really flexible about creating clean data sheet and then able to capture data and able to populate, right? So for that matter, Steph is just really there to review what is correct and not correct instead of just really managing that. Some other areas, of course, I understand, especially in healthcare industry, not everything can just simply automate it into those digital process, right? So if, especially serving more of a senior patient, if there are paper-based documents they have to fill out, I mean, typically each process, I think one thing pretty straightforward is having some forms of the documentation, right? So that's where AI comes in, capturing documents to capture those handwritten documents. And obviously at the end, machine is machine. If a person cannot identify those written words, then we can expect machine to do that. However, as long as we can do that, we can still automate those pieces and then digitize those data to support this process automation. And jumping into more of once we have those clean, standardized documents and data flows of the structure, then we can really streamline this process automation. Some of the things I'm hearing often in this industry, especially even EHR, right? I mean, it's both panels mentioned Cerner's, Epic. I mean, they are 2 leading EHR. However, we actually did a market research really focusing on majority of Cerner and Epic users. And one of their kind of big bottlenecks is that they can't at the end achieve what they want. And some of the things that they mention about there are too many clicks that they have to do to really do the process that's really core functionality outside of these systems, right? And that's where things start getting siloed and duplicated. Some steps may not have clear visibility if they are working with a third-party lab or external organization to do some clinical data processing. They have no idea when it gets completed. And I think that's where process automation can come in. The thing is, it's not just about documents, right? Technologies are moving, pretty on fast pace when it comes to developing to serve those industry. So some of the areas that they can also do is put the granular control to protect compliance measurement within this industry. So yeah, it was kind of like a long way of different answers, but yeah.
Okay. Excellent, Grace. Thank you very much. John, let's talk about, Grace mentioned forms and things like that. And when we talk about systemness, we want to have that same, because we talked a lot about standardizing EMRs, and that's sort of one level of it. But there's another level of it of just sort of that basic patient experience, going into a clinic, going into an imaging center, going into the hospital within one health system at different times, and wanting them to know who I was. Right. I went to this part and they had your sign up of your health system. And then I went over here, and man, I'm telling you, just me personally, you ask for my information again. Like it does something to me. It makes me lose my mind. I just can't, because I hate filling out those forms the first time. So you want them again. Anyway, just yeah, I got a little sidetracked. Let's talk a little bit about that on the patient experience. I'm sorry, John.
Right,
It's
right.
true. It's
No,
true. It just hits a
it
nerve with
is.
me. Go ahead.
I will tell you, I've had the experience myself, so I get it. It is real. I think the approach we've taken is we're focused on the mobile experience, corresponding web experience, and how do we deliver that to solve a number of operational challenges, but also to serve our patients. So that aspect of it, we call that mobile check-in. So how do we help you as a patient when you are coming to see us? We want you to fill out certain forms before you get there. So that's beneficial to us because that helps us see you quickly. It helps the physicians with what they need to do to be able to see you and be focused on the visit. So one of the ways in which we've tried to address that is with mobile check-in process. So we send you a notification, hey, confirm you're coming. You say, yes, you're coming. Then we're going to send you, here's what we need from you to fill out based on the visit that you're coming for. If we've seen you recently, we're just going to ask you to verify quickly. Has anything changed? You say nothing's changed, you're done. So when you walk in to a primary care clinic of ours or a specialty care clinic of ours, you've already done that pre-work and we know who you are. So we're not going to ask you to fill that information out again because we know the front office staff knows that you've already done that.
Mhm.
Now, there's always going to be a scenario where some patients don't do that before. And what we do then is we push that information to their smartphone and say, hey, we're going to push some information to you. Click on the link, verify the information for us, and then we'll be right with you. But that's the approach we've taken to really alleviate that. I think the other part of it is, you talk about standardization. Particularly when you get to specialty clinics, every specialty has a certain set of forms that they're most interested in that's different from another specialty clinic. So what we've done, we have a forms committee that is really going through the various forms that we want patient families to fill out, even on the specialty side, to say, okay, what can we do that's common that everyone can use? And then what really is going to be locally specific to a specialty that's so unique that you may have to have a separate form. So we're going through that process right now to determine what are those special forms that we'll have to make available to really get that experience fully realized. But that's the kind of approach we take because we know it's a pain when you come in and ask you for the 10th time. Can you fill this form out again for us?
Oh
Can you give me
boy.
your insurance card again?
Oh my. Well, I'm
We know.
glad you're
We know.
working on it. I'm glad you're understanding my pain. So appreciate that. Dr. Rob, I want to bring you in. I want to talk a little bit about M&A, and that kind of a thing. So M&A This is the kind of dynamic we're talking about where you change the sign, but that's all you've changed. And maybe I wind up at the new place, and there's a time issue here, right? It takes time for the real work to be done under the hood to get some real integration done so that you do have my information. You might not have it on day one. Maybe you change the sign on day one, but you don't have my data on day one. You might have it on day 60, which may be okay or may not be fast enough, depending on what you're trying to achieve. But talk to me about M&A and how what you think are maybe some best practices around how IT can be included before, during, and after M&A so that that can be done as quickly as possible. So it doesn't get dropped on you at the last minute. And then you say, well, this is going to take a little while. If you guys had brought me in earlier, we could have been in much better shape with this. So anyway, your thoughts.
So we recently did something, the very big neurosurgery practice. So there are business people. As a standard, the business people initiate it, the administrators talk about it. And since we have one EHR now, so obviously everybody wants to be on it. So then we are brought in, and by the first meeting or the second meeting, we do our own assessment. We give a price to it. If it's a private clinic or a private hospital or private something, what the cost will be. If you are acquiring or they are becoming part of us, how much money we have to pony up. Because IT is not usually very cheap. So we have a finance talk about it. And then we talk about the resources we need. Some we may have in-house, some we may have to get from outside. But at the same time, we also do a workflow analysis and we do our process analysis. Once we have done all that, then we talk about training. So we are doing it collectively. But once again, the leader in this is the operational leader. Once again, we try things out together and we give a timeline. And we try to stick to the timeline because if we don't be on timeline, then it costs money too. So we have become very good at it. That means working together, doing the things together. And let me tell you what is more important, which you just asked about asking the question other times or not. So we do an EMPI match, Enterprise Master Patient Index, before we bring somebody else. And then we do an upload so that the doctor doesn't have to go look for the patient and not in the desk. We also bring the record of the patient so the doctor does not think that, hey, his history physical is not in, his lab is not in, because we take care of that now. So that part is there. But more important than that, we also don't want the patient to feel bad that we don't have their information and they have not filled the form. On top of it, when the patient goes home and they want to connect to us, we take care of that too.
Excellent. Grace, any thoughts around M&A? I would imagine a lot of the people that you work with as customers, they've done some M&A and they're trying to, again, bring about more of a system feel and automate different things and get the newly acquired entities onto their systems. But what are your thoughts around M&A?
Yeah, some of our, I guess, actually, what I would really consider as a little bit more fast-paced, successful cases than some others. I think they at the end really focus on kind of what we talked about, like end user experience, right? And just identifying what process really needs to be prioritized before than some others and really targeting low-hanging fruit. Definitely unifying those documents and process is really critical. From there, they really try to create more of the seamless process. And once they do have that, I think cultural integration in terms of change management automatically kind of flows down, right? And then of course, like IT people, the team of IT and then end user also do agree. And I think that's when they really can understand each other's position, because at the end user has different initiatives, and then there's other criteria that IT also has to pass in healthcare space, right? And from there, I think once they understand that flows, it's pretty a quick pace to expand that. Another thing I really want to highlight is once that expansion is done, also I think based on the first experience implementation process gets also quickly as well, because in healthcare space, we do have to prioritize operations and risk management as well. And I was actually just on a call with one of our customers based out of Texas, and they just completely transform multiple cases that fall under risk management just for implementation process actually took 6 months. I think that is amazing. Of course, there were some planning phase that were implemented previous to that, but it just pretty much shows that once they get the momentum and understand what each system's benefits are and how to drive that, once they identify initiatives and challenges, I think it's pretty quick spread of the successful achievements that organizations experiencing.
Very good, Grace. Thank you. All right, we have just a couple minutes left, but I'm dying to hear what you want to ask each other. So I'm going to start with you, John. Do you have a question for one or both of your co-panelists?
Yes, I do. This is going to go to Dr. Rob. Obviously, you've imparted a great bit of wisdom today. But as you've talked about the relationships that are required, can you share a little bit about your approach to establishing the business relationships that helps you drive these initiatives forward to serve your organization and your patients?
I think you have to be genuine and you have to be honest. But while you are doing that, you have to be humble about it, because I have found out that being a technologist, you're already like 50 yards behind, because people think you know a lot. So you have to shed that out. And to do that, you also have to include people from the beginning in your governance committee, because everybody is unique and unprecedented, and every human being has some wisdom. And collective wisdom is better than one person's wisdom. When people get to the collective decision mode, and when people are heard and their opinion is counted, that also helps. And offline conversation also helps. Heads up also helps. Let's not surprise people in a meeting. Like my boss wants to talk about something today in our administrative meeting. He just came and gave me a heads up, even though it's a 4-hour heads up, but it was good enough for me to have that heads up. You know what I'm saying?
Yeah.
And if you have done something wrong, and ask for forgiveness, or be open about it. Apology is not a bad thing. And last advice that I have for myself, people don't forget how you make them feel. So don't make anybody feel bad. It's not the right way of approaching. That's how you'll never get there. And always listen more, talk less. These are the things I have adopted. I'm still working on it. I'm not perfect at it. And sometimes I've been successful, and sometimes I've not. And the last trick I will tell you, if you do a little bit of help to some people, they do remember that help. So that helps a lot.
That's a lot of great stuff there that'll help you in all facets of life. I think. So excellent. We've got time for sort of a lightning round of final thoughts. So best piece of advice for your colleagues. They're heading up technology at a health system, and they're really trying to get that systemness going. Best piece of advice. John, we'll start with you.
I'll say, really, you sit in a view to understand and see what's happening within an organization. Go talk to the business. Go see the business and how it operates, and see where they may have opportunities by listening and asking, how's things going? What challenges are you facing? and they will tell you. And then once they tell you, then you're in a position to try and help them solve that challenge. I say start there.
Excellent advice. Dr. Rob, your final piece of advice.
My advice to myself and to my colleagues are the following. Only one sentence, I'm not a large. There's a quadruple aim, we all talk about it, which is the physician and the caregiver satisfaction, the staff satisfaction, patient experience, and the value, that's the money. Whatever we do, whatever we say, we have to include all those four in our head so that when we become a partner to our business leaders, to our physicians, and to the staff, if we keep those four things together, it will help us propel the mission, because we have to make money. We have to decrease cost. We have to take the burnout out. We have to come through for our colleagues, because only one word that's I was going to tell you, this is our time. This is the time of technology. This is the time of ML and AI. This is our time to seize that. Those four things will get us forward.
My goodness, I'm about to run onto the field and start playing the game. That was a good inspirational speech. Grace, your final thought.
Yeah, I mean, at the end, people are people, right? And everybody wants to feel value, and especially in healthcare staff. I mean, in my experience, when I communicate with them, at the end, they want more time to serve patients, right? Make them more satisfied and able to provide the service that they are looking for. So yeah, just, I mean, in the sense of AI, there are many kind of feedback from all different kind of backgrounds, right? And some majority of the people, I think, are more nervous, oh, AI is going to take over some of the labor. Is it true? Yes. However, let's look at more of a positive aspect. AI is not really here to replace the job completely, right? They are here to support the people to do more of a value work. So yeah, as Dr. Rapp just mentioned, technology is here, and let's take advantage of that and to see how we can empower people.
Awesome. Wow. Amazing conversation, went by in the blink of an eye. Regarding continuing education, you could use the final slide in this deck. You'll get an email when the on-demand recording is ready for viewing. If you want to work with us, you can reach out to Nancy Wilcox from our team and go to our website to register for upcoming panels. With that, I want to thank our tremendous panel, Dr. Shafiq Rob, John Henderson, and Grace Nam, and I want to thank Laserfiche for making the event possible, and you for attending. And with that, everybody have a wonderful day. Thank you.
Thank you.
Thanks.